Hi everybody, it's Randy Kurtz again for the ISB with Stretch or Tip of the Month. I am here this month at the European Massage Therapy School, and I'm here to talk today about things to look for and not look for when you go for a massage related to our bass playing activity. So, you may go for massage on a regular basis or for a particular problem you may have. Good idea in both cases. What we're talking about here, though, is what you may want to tell your therapist and how to sort of clue them into things that may be going on with you to help you to recover and to get the most out of your massage. So, in this case, what we're talking about is muscles in the upper back particularly. The rhomboids, great muscles to start with. Rhomboids right here in between the shoulder blade and the spine, which retract or bring back the scapula. So if you're playing like this, you're going to get tightness in these muscles a lot. So when you go to your therapist, ask them to work on the rhomboid muscles in particular. They'll pay extra attention to those muscles in the scapula, maybe move your shoulder blade out of the way in order to have better access to them. Also the intercostal muscles, muscles in between the ribs that make those muscles there tighten up, which makes your rib cage and your whole middle back area, front and back, feel tight. Maybe even more so when you take a breath. Those intercostal muscles in between the ribs, a good place to go to as well. As far as low back, we have the QL muscle, the quadratus lumborum, which goes down here, connects to the hip, to the spine, and to the bottom rib. And what that does is enables the body to laterally flex like that. So if there's tightness in that muscle there, that is a good place for the therapist to work at, especially if you're sitting for long periods of time while playing or bending over a lot, just having general backaches. They will work on the muscles of your low back, but the quadratus lumborum, laterally flexing, a good place to tell them to work on as well. When they work on your arms, you're looking for both sides of the forearms, flexors and extensors. If you work on one side, the other side will tend to still be tight in compensation, so you want to make sure that you get both sides of those worked on. They will certainly address the neck area and the back area, and they know how to do that pretty well, but these particular muscles are areas that, again, for the bassist, are areas of particular concern and that you want to have checked out. If you have a tendonitis, you don't want them digging in to that area. It'll probably be here, or maybe anteriorly here or here. These areas are going to be a problem because there's already inflammation there, so if the therapist starts digging in, it's going to be uncomfortable. So you want to make sure you tell them this if you have been diagnosed with a tendonitis or if it's uncomfortable when they're doing it. These are my tips for the month. I am Randy Kurtz again for the ISB. Almost forgot my name there, but I'm not going to do it again. You can believe that. So, signing off. See you next month. Thank you very much. Adios.